Hi, this is Dr. Cromwell, and I'm with James Pongris. He's a patient of ours for a little while now. He's going to go over a few salient points about his case, and then he's going to get into more details after that. So take it away, James.
Yes, I'm a Marine Corps veteran suffering from Agent Orange-driven leukemia. And because of the difficulty of my treatment, some of the drugs I've been on have caused a significant increase in the inflammation of my cells in my body, measured in the blood by looking at your CK and CPK levels. I could sit here and talk about many of the non-measurable values of this pulse treatment, such as I sleep better, I have less anxiety, I have less digestion problems, I recover from my chemo faster. But I'd rather talk about some hard data-driven points that have come about in a very short period of time of about a month. So my inflammation reached levels of 38,085, with normal being between 30 and 130. And after right around a month, give or take a day or so, my inflammation levels dropped to 1,700. So statistically, a very significant shift. It's measurable, it's quantitative data, and the only thing I did was, in fact, to receive this treatment from Dr. Cromwell and his staff. So while 1,700 is still high versus the 130, it's continuing to drop. And to just give you a sense of this, when you have inflammation at that level, there's some side effects to it that are extremely difficult. You get massive muscle cramps at any point in time in the middle of the night that wake you up. And the muscle cramps are so strong, they last for hours, and you're debilitated to the extent that you can't move. If you're laying in bed, your only option is to roll over and fall on the floor because you can't sit up, you can't walk, you just have a very difficult time. And but after starting this, and I started it, I received treatment for the leukemia at Ohio State University in Columbus, Ohio. And they were the ones who recommended I should try this. And again, it has produced a sundry of benefits. As I say, I sleep better. I've stopped having headaches. I have less congestion in the morning when I wake up. My stomach bothers me less. I recover quicker from the chemo itself. And my golf swing has gotten a lot better. So,
Great.
So
would you recommend it to your friends?
Oh, I definitely would recommend it to friends and family, and in fact have. And later today, Dr. Cromwell's hosting a information session where I have both my daughter-in-law and sister-in-law who are very interested in this thing because it's produced such significant, measurable benefits to me. So, and I keep emphasizing the measurable part because a lot of times people say, well, I feel better, but what does that mean? And is it a direct result of these things, or is it just a sort of a placebo kind of thing where it'll go away after a week or two? In this case, we can actually measure these results and see continued progress in these results. I will also say to you that the other measurable element is that because of these drugs, my cholesterol level also jumped above 300, with the bad cholesterol being over 200. And during this same time frame, this month, give or take a day, that cholesterol has come back down under 200, and the LDL, or bad cholesterol, is now operating in the normal range. And again, I haven't changed my lifestyle. I manage a company that operates in 12 countries, 26 states, 10,000 employees, and a lot of pressure, a lot of stress from all of that. But, this is the only real thing I've done. And, it's produced wonderful. I get it for an hour a session, 2 sessions per week. And again, I think it's the best investment I've made in a long, long time.
Thank you very much.